what really keeps me up at night is that we forget, is that after COVID-19, we think, okay, that emergency is over. And really, the emergencies are never over. So people ask, what is ASTMH doing about this? And there's quite a few things that are happening. First of all, many ASTMH members are, of course, scientists that are doing research and different things with this, involved with vaccine studies and trials. So that's, the important and the core function of all of us as scientists and public health workers. But equally important is really a voice for what's going on, and a voice in different contexts. So one of those voices, of course, is to communicate the science. We've seen some of the things ASTMH has put out to support WHO, recognizing that WHO is still an extremely important organization in the response across the world. And then the journal, of course, the Society's Journal, the American Journal of Tropical Medicine and Hygiene. Information coming out there, not only in terms of reporting on the science, but editorials, people weighing in about what's the right move, how do we analyze the given situation and the data. So we're seeing a lot of roles for ASTMH as the voice of science and public health, and that's an important function. We know that there are always pathogens that are milling about in nature that have the potential to get into humans. And so we can never forget. We can never say, okay, that one's done. Now preparedness, now funding for research, funding for public health response is not a priority. It always has to be a priority. A very clear example for that, and quite frankly, is that after the 2003 SARS outbreak, which was also due to a coronavirus, and initially, there was quite a big push to building a coronavirus vaccine. And then when we saw no more SARS, people said, okay, well, that's really not a priority for us. And so we lost our way with that and lost our drive. This is not the same virus as 2003 with SARS, but nevertheless, it's a coronavirus. If we had a vaccine for that SARS virus, we would be much further along in developing a vaccine for COVID-19. So important that despite all the pressures for US Congress, for other governments in the world, that we recognize that outbreaks, unfortunately, are something that are always going to be on the horizon, that we need to recognize that. We don't need to view that as, it's not a thing that we should panic about. All we need to do is understand that they will always come, that the investment to prevent them from causing the huge disruption that we're seeing now is really the way to sleep well at night. One of the most important things is just for this outbreak and other outbreaks is speaking the truth. And that what I mean by that is that science is real, that we have a process to understand the truth in science. It's not something that's arbitrary. It's not something that comes through a declaration. It's something that comes through critical study, organized methodological study. And we need to make sure that we are always tied to that truth and tied to that evidence base. And so I think that's one area that people can contribute. If you're a researcher, you can produce the evidence. Even if you're not a researcher, you can support, you can tweet, you can write, you can make sure that people, the general public, can be a spokesman for the general public, translate that scientific truth down to the actionable, correct points that we need to fight COVID-19.